Hey everybody, welcome back to the channel. Before we get into the next video or live stream, depending on when you're actually going to see this, if this is your first time here and you like the information and content, please hit that subscribe button, click on that little bell icon, that way you get notified when I post new videos or do live streams. Or you can click on that little picture watermark of me and my beautiful wife down in the corner when this turns into a video, and you can subscribe that way. With that being said, let's get down to it. As a former healthcare provider, first responder, and life support instructor, I feel that I have an obligation, because I am still involved in the healthcare field, to give you the best information that I can come up with regarding this topic that seems to be very touchy on YouTube, and especially in the rideshare industry, and that is just what the title says, the coronavirus. I've been online for 9 hours doing research with CDC, WHO, and multiple other organizations regarding the cause, effect, and what this is actually doing to to people, and so on and so forth. So hopefully I don't get a warning or whatever. But again, as a healthcare, I'm still active in healthcare. So as a former first responder, life support instructor, and someone who is still active in the medical field, I am going to say it the way it is. I'm not going to sugarcoat it. I don't want anyone to panic, but I want to do my part and give you the best information that I can give you, and hopefully it'll help you out. So with that being said, here we go. The coronavirus, or COVID-19. COVID-19 is when they actually discovered this. And hey Donnie, hi Lisa. I'm not going to be looking at the chat right away. I want to get through this live stream. I don't mean to sound rude, but I really want to oh, come on Donnie. All right, I got Rideshare Lisa in the house. I got Go Donnie COM, outlaw of Rideshare, in the house. There's your love, baby. Check out his channel. Check out Rideshare Lisa too. If you're in the delivery, doing the delivery gigs, she's got a lot of really good information. Check out her channel, Rideshare Lisa. Check out Go Donnie COM, and there's your love, guys. So back to the stream. We're talking about the coronavirus. So, and I'm not going to be afraid to talk about it. I'm not going to skim across anything. I am an independent contractor, and if Lyft or Uber are going to give me any crap about this, then that makes me an employee, and that puts them in a really bad spot, because technically we're not employees. So anyway, let's get down to it. So like I said, I've been online for about 9 hours trying to do as much research as I can to make sure that I have as much correct information as possible. Are you guys seeing me okay? Because it's not showing anything on my counter. Is it buffering, or Lisa, do I have a good stream before I continue? Because if I don't have a good stream, I'll start it over. Or Donnie, either one of you two. I know you guys are 2,000 miles away, so really? Well, let's see what. Yes. What? Yes. Am I buffering, or is the stream good? B for buffering, G for good, Lisa. Don't mind the focusing. Or Donnie, B for buffering, G for good. I want to get this going. Don't mean to be rude. I got to get out. Okay. Thank you. All right, so here we go. What is the coronavirus? The coronavirus is a large family of viruses which may cause illnesses in animals or humans. Now, we all know where this started, and I'm not going to drop names, but it was started actually at an animal sanctuary, where it was transferred from animal to human, and then went from the epidemic that it was in that area to a pandemic, which is worldwide. So from what I've read from the CDC, World Health Organization. It is spread, cats, dogs, cows, bats. But I want to do this stream, and I want to make sure that people are not going to freak out about this. Now, Rideshare Professor made a video earlier today, or was it yesterday? I'm not sure. I'm really tired. And he brought up a good point. Stay away from the airports, especially the large airports, at least until CDC can get this thing under control and find out what's going on. You're going to the bum lot. You don't know what kind of rides you're going to get anyway, and now you're throwing in this COVID-19 into the mix. And I personally don't do airport runs anyway, so it doesn't really affect me one way or the other. But one thing that people haven't talked about is hospitals. Now, in my market, we have 2 hospitals, and Lyft is contracted with a company called Call the Car, which does medical transportation. So as Lyft or Uber drivers in my market, we are picking up patients from hospitals. And where is your next highest concentration of going to be? It's going to be in a hospital, because if people are going in there and actually have contracted COVID-19, then the hospital is, our hospitals are actually on alert. So they've already taken the appropriate measures, and I was pretty impressed how quickly they jumped into action with that. So just like Rideshare Professor said, stay away from the airports. Airports, in my opinion, aren't worth it anyway. But if you really are concerned and are afraid that this is something that may affect you negatively, or obviously when I say you, that includes your family and of course your passengers too. Don't do hospital pickups. Don't do hospital pickups. I know where my hospitals are, my urgent cares, because I used to transport people there when I was first responder. So I kind of have a little advantage. Know your markets. Know where these places are. If you see one pop up and you're not comfortable, don't take it. So anyway, what are the symptoms? Most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. That's where it gets kind of scary, because it actually could present itself as a common flu. The symptoms are very, very similar to a common flu. So if you think you got the flu, then obviously go get checked out. Now, there is one point that I want to stress that I read through CDC. If you are going into an urgent care or a hospital or to see your primary care physician because you think you may have COVID-19 or the flu, call them first. They're asking you to call them first so they can be prepared properly when you show up, to obviously minimize the risk of spreading this any further. Whether you have it or not is, obviously not going to be known until you actually get yourself checked out. And again, I'm sorry, I'm not reading the comments right now. I want to get through this stream. I'm not trying to be rude. I just want to get this done. So call your healthcare provider first, your hospital first. Let them know you're coming in. Let them know what your symptoms are so they can be prepared in order to try to, minimize the spread of this. And until the CDC comes up with something, me personally, no airports, and I'm going to try to stay away from the hospitals too. That is my choice as an independent contractor. If I get in trouble for that, that makes me an employee, gives me the right to sue them. I mean, let's be serious. I mean, let's keep it real here. That's why I made this channel. I wanted to be able to break things down, do things a little differently than mainstream, and give you the information that I can give you to the best of my knowledge through what I'm seeing through reputable sources. So again, this coronavirus presents itself just like your common flu. So if you have, again, the symptoms are fever, tiredness, dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. These symptoms are usually mild and begin gradually. Again, call your local emergency room or your doctor or urgent care. Tell them what you're presenting with and get yourself checked out. Okay. Now, there is the one little thing that I did catch is that some people are hosts or carriers. Those are people that are actually infected with the disease but show absolutely no signs or symptoms of having anything wrong with them whatsoever. And eventually their body takes care of it and it's done. Now, the incubation period for this COVID-19 is also 1 to 19 days. So from the day that you actually contract this disease until it actually starts showing itself or presenting itself could be from 1 to 19 days. So you are more contagious before you have a cold than you are while you have the cold, because obviously you know you have it. Same thing goes with pretty much everything. Before you notice symptoms, you're going to be more contagious because you're not aware that you have something. So again, that's the tricky part. And then, of course, being a host, not having any symptoms at all, which is, again, all this stuff is just, I don't want people to get the wrong impression. I'm just trying to give solid information as to what this is about. So, again, it presents itself like a common flu. If you're sick, don't drive. If you're worried about possibly getting ill from a passenger, like the rideshare professor said, stay away from the airports. Don't do the hospital pickups. Just let them roll through, and that's it. Until CDC can get this under control or get a grip on this, do whatever you feel necessary to protect yourself. Dustin is driving. Did a parody video which was pretty funny with real rideshare stories. But Lysol, hand sanitizer, carry tissues in your car. If you cough into your sleeve, what have you. That's the part that I wanted to get out. So that was the major part. Is, again, this is for drivers and delivery gig workers to make sure you stay protected. Second thing now is, let's take care of our vehicle. So Lysol works very well, and your cabin air filter, depending on what year your vehicle is, a lot of newer vehicles have cabin air filters, and they obviously do just what they say they do. They filter the air in the cabin of the car. They also filter the air coming in from the outside of the vehicle. Now, obviously, if there's something in the car, it could be spun around in the air before it actually gets through a filter. And what CDC and World Health Organization are asking is, get cabin air filters that actually are HEPA certified, like a HEPA filter. They are a little more expensive, but they do a much better job. Second thing you can do is what I call bombing your car. Lysol, get a fragrance that's not too overwhelming. Believe it or not, Ozium works very well too. But I would, at this point, just to stay safe, say Lysol. And no, I'm not endorsing Lysol. It's just a good product. Start your car. Turn your blower onto high. Turn your heat up, which will make the interior of your vehicle, your upholstery and headliners and stuff like that, expand, because heat makes things expand. Turn your air on recirculate, and either crack a window or go to your back door and just open that can up and just let it blast into your car. Kind of move it around back and forth a little bit. Let it, you want to see a nice thick fog in your car. When you can start seeing it start rolling out that door, you've probably got enough in there. But really, just back and forth, real heavy in the car, air on recirculate, the heat on to make the interior of your vehicle a little warmer, and again, get a nice thick heavy fog of Lysol in your car, and then close the door and let it. Sorry, I got a call coming in. And let it circulate through the car for about 5 to 10 minutes. Sorry about that, guys. If you want to do it a second time, do it a second time. Crack that rear door, go back in, fog up the entire, just fog up the inside of your car, and close the door. Let it circulate. Hey, what's up, Roy? Let it circulate through your car for 5 to 10 minutes, and then air your car out. And you can do that every day. You can do that every hour. You can do it while you're out on the road. Shut your app off for a few minutes, bomb the car like I just explained, and then go back to work again. You definitely want to. It's going to be kind of strong. Sorry, guys. Let me clear this message out real quick because I don't want to. There we go. Sorry. But our safety is important. Our families are important, and like I said, Donnie said that they're shutting live streams down because of this. Well, you know what? We'll see how long this video stays up. But there are so much stuff for this. But right now, who is at risk? One of the I think I'll leave a link in the description so you guys can check this out. But if you want more information on this, type in World Health Organization. It's WHO, World Health Organization, and then search for COVID-19, and it will give you a list of things that you can do, Q&A, FAQs, all that stuff. If you want more information, go to the CDC. They've got a very well broken down pages regarding this also. So again, I really didn't want this live stream to go on this long, but it's actually 16 minutes. It's not too bad. What's up? No Crybaby Lifestyle. I already said hi, Roy. We're talking about the coronavirus, and Donnie said that they're pulling these things down. I personally am not afraid to put it out there because I am a former healthcare provider, and if YouTube wants to pull it down, then I'm gonna have a nice argument with them because I am still active in the healthcare field, in the medical field, and I believe I have the right to share this with my drivers and my friends and my family and whoever is gonna watch this. And if anybody wants to share it, let them share it. So I'm gonna do a recap on this, and then I'm gonna get ready to head out. So just like I said 17 and a half minutes ago, we're talking about the coronavirus. Yes, I'm saying it out loud. And so let's go back to it again. What is a coronavirus? Viruses. Now, there's multiple different types, but COVID-19 is the latest one that was unknown until December of 2019. So that's where they got that from. Coronaviruses are a large family of viruses which may cause illness in animals or humans. And like I said at the beginning of the video, this can be contracted from an animal. It was actually first, I think they narrowed it down to what I read. They narrowed it down to an animal rescue where it was transmitted from a human to it was transmitted from an animal to a human. So then it went, they had their epidemic, and of course people going in and out of these countries. Now it's a pandemic, and until CDC gets a good grip on this, I'm just kind of revamping what I said earlier. Rideshare Professor made a good video. Stay away from the airports because international stuff, obviously. It's a bum lot anyway. You don't know what you're going to get, and to throw the risk of catching an illness in there, to take home to your family, to pass on to your passengers, it's not worth it. So I don't do airport rides anyway. I don't want to sit for 2 hours for a $10 ride. That would be my luck. Second place to avoid if you really are concerned about this is hospitals. Again, I'm rewinding, so I'm starting from the beginning. Where is the highest concentration of this going to be in your area? It's going to be at a hospital. And in my area, Lyft contracts with Call the Car, which is a medical transportation company, in order to get patients home. So yes, we are put in the crosshairs of that. If you really don't want to do it, then you need to know your market. You need to know where your hospitals are. I know that, the addresses of my hospitals and my urgent cares, because I used to take people there in ambulances. So I know which ones to avoid. But airports, Rideshare Professor made a good point. A lot of people are saying stay away from the airports. What caught my attention with the Rideshare Professor's video was rental cars have gone through the roof, and basically nobody's got rental cars. So those of you that are driving with fare or hire car or whatever it is, that are using a rental car to work on one of these rideshare platforms, and maybe you're coming into a point where you're going to have to turn in that vehicle and switch it out, you have every right to make sure that the vehicle you're getting into has been sanitized. Not just a quick wash and vacuum. I mean literally disinfected, sanitized, or sanitized. And if they say, "Oh, we took care of it," tell them you want to see the cleaning of the vehicle. If they can't, if it doesn't say vehicle was sanitized or whatever, find another one. Again, I'm not trying to start a panic. I'm just trying to share information. So, that's one way to avoid it. If you're in this gig industry and you're using a rental car, is to simply have the rental car agency say, show you the paperwork that car was sanitized. It's not hard to do. And again, if you want to sanitize your own vehicle, then what I would recommend is getting a nice can of Lysol that smells good, roll up all your windows, start your car, turn the heater up, turn your blower on high, hit recirculate, and bomb your car till it fogs up to you. Basically, looks like you're in San Francisco, and then close your doors, let it circulate through your car for 5 or 10 minutes. And if you want to do it a second time, go right ahead. Again, fog it up, close your doors, let it continue to run through. Open your doors, shut your car off, and air the vehicle out. Now, another thing you can also do is change your air filters. Cabin air filters are not that expensive. However, CDC and a lot of other medical sites I've been looking at are saying get the HEPA style cabin air filters, which are capable of catching microscopic particles better than your typical cabin air filter. So, do regular changes of your cabin air filter. If you're out on the road and you pick up a passenger and they're coughing or whatever, and you're not real sure of that, or whatever, once you drop them off, cancel the ride, bomb your car for 5 minutes. The extra 5 minutes is worth it. I can see you're putting stuff out there, Roy. It's really small, and I'm not getting into the chat right now because I really want to end this live stream. But so I'm not trying to be rude. I just want to put this out there. So again, that's about it. I mean, don't be afraid to shake someone's hand. Just make sure you don't rub your eyes or mouth or your nose or whatever it is after you shake that person's hand until you've put some hand sanitizer on and cleaned up. And again, hand sanitizer, minimum of 60% alcohol, and again, it's just in my opinion, and this is again just my opinion, just keep your hygiene up. Just look at it, like I said, it presents itself as the flu, and keeping your hands clean, keeping the interior of your vehicle clean, stay away from the airports if that's what it takes, stay away from the hospitals if that's what it takes, take care of your vehicle, make sure that you're using Lysol and antiseptic wipes if you have them, whatever. Just don't panic. I mean, I've actually seen drivers, and I'm not going to say on which platform or platforms or whatever, with masks on. It is your car. We are independent contractors, and we have that right, if we want to wear a mask, to wear it. But what is our passenger going to think? Are they going to think we're sick, or are they going to think we're afraid they're sick and file a complaint? So, everything about this is very touchy and very I don't know. It's very gray. But again, just practice good hygiene, keep your cars clean, stay away from the airports, stay away from the hospitals for a little while if that's what it takes. And hopefully, I'm pretty sure you'll be fine. Just be aware of your surroundings, and meaning your passengers, when you pick them up, as you would when you're waiting for a ride or when you're picking somebody up. Lock your doors, roll the window, ask for the name. Listen. This is one where you have to be a little more in tune with what the passenger is doing versus what they're saying. We're not asking for a name. We're not asking if they know our name. We're listening for a cough. We're listening for sneezes. We're listening for sniffles, all that stuff. Anything that may throw up a warning sign. And obviously, saying, I'm sorry, I can't take this ride could possibly lead to a very negative ending for a lot of things. So take the ride as you would normally take your ride. And then if you are concerned about somebody having that COVID-19, drop them off, drive down the street, and bomb your car. Clean things up a little bit, and wash your hands and what have you. You'll be good. So that's about it. I'm actually doing this on my phone because I was using my laptop down here to read. So now I'm going to get into the chat a little bit. What did you say, Roy? Keep your balls. Great. I had to say that. No, great. Now I'm going to have to mark this private. Oh, Roy, you're such a man. I'll tell you what. You've got 16 days, Roy, and my ass is coming to your city. So that's going to be interesting. Lisa, what happened? What happens if it pings? How are you? Okay, Lisa had a good question. What happens if I pick up somebody at the store and they just came from the airport? That person's got some issues, because I'll tell you what, if I just came off an airplane, I want to go home first. I'm not going to stop by a grocery store to pick up a few items before I go home. I'm going to go home. I'm sorry, Lisa. That was kind of funny. I don't think if they just got off an airplane that they're going to go straight to a grocery store. I mean, in this industry, anything's possible, but that's a good one. Let me go back and check out some of these. If you guys have any, I've got so many people watching right now. It's crazy. I've got 3. But if you guys have any questions, feel free to ask. But I've pretty much covered what I wanted to cover on the stream. I'm probably just going to mark this as a private video and then just do a follow-up video to where I can actually get through it. Stop eating bad bat, yeah. God, Donnie, you're disgusting. That's why we love you. Yeah, and see, that's what I was told too. Bats, cats, and I'm not trying to make a little rhyme there. Cows, livestock, and dogs. So this is something. We got Ben Dover in the house. Thanks for joining, Ben. That's something that again, that's one of those weird diseases where, if a cat gets parvo, we're not going to get parvo. If a cat gets a feline disease or a dog gets, a disease, we're not going to get it. This is one of those things where it's actually transmittable through animals and humans. And I think that's one of the big scares is, now that it's out there, hell, does my cat have it? Kitty? Seriously, am I going to take my cat to a vet and have him draw blood? And, that's the pandemic, and that's the scare is, nobody knows. But I can tell you, I'm not taking my 2 cats or my 2 dogs, which are indoor, outdoor. My cats are indoor. My dogs are indoor, outdoor. And have, $200 worth of blood work done on 4 animals, it's just $800, because I'm panicking. There is no need to panic. Again, It presents itself like the flu. If you have flu symptoms and you think you may have contracted COVID-19 from a passenger, contact your primary care physician, your emergency room, your urgent care, whoever it is you see. Let them know, hey, I've got these symptoms and I drive in rideshare, so I'm with a lot of people a lot of the time and I'm concerned. I'm going to come in. That's what the CDC is asking you to do so your healthcare providers can properly prepare for you to come in. Like I said, the hospitals in my area are on full alert already, and everybody's wearing, they've got their PPD devices and masks and goggles and everything. I mean, gloves. They look like they're coming out of a test facility. And to be honest with you, great. Hats off to them. They're doing their job in trying to reduce the spread of this. So, okay, let's see. Okay, so Donnie, in response to Go Donnie, yes, it has killed 3,000 people. Actually, the last numbers I saw today was 2,800. But that's nitpicking. Let me check something out here real quick because you're gonna love this one. Let's check out this. And remember, Donnie, the people that were that have lost their lives to this were elderly, just like the flu. Hold on a second. Okay, so what I just did is I did a Google search for, and I've got a few of them here. This is from, again, this is WebMD, but this is also from the Center of Disease Control. CDC estimates that as many as 56,000 people die from the flu or flu-like illnesses each year in the United States. Okay? So, hey, Vegas Rideshare 888. Wow. Welcome, man. It's been a long time since I've seen your name up on a chat. And I will be in your city March 20th, 21st, and 22nd. I am racing. I'm looking forward to meeting Roy. And if we can hook up, that'd be great. I'd love to do some stuff with you guys, even have you come to the track. So, Donnie, on the average, 56,000 people die from the flu in the United States every year. We're talking 2,800 people, roughly, that have succumbed to this disease, and the majority of them were in the country where it originated because it really caught them by surprise. Yeah, you're right, Donnie. And you have a good point. Again, another pandemic, but you got to look at it from, like I said, this is just my opinion because I've been in healthcare for 25 years now. We've come a long way. Colds would kill people. Flu would kill people. I mean, hell, you could cut yourself on something and get tetanus and die. Nowadays we have vaccines and we have medications and stuff. The one thing that does make the situation a little different than others is it's not a bacterial infection, it's a viral infection. A bacterial infection can ramp up really, really quick and literally just, I'm glad I'm 18 or over. A bacterial infection can kick your ass when you start presenting symptoms. Within a couple of days, you can just be bombarded because bacteria in our bodies as a host is the perfect environment for it. So yeah, it can ramp up super quick. Viral infections take a little longer because just it's a bacteria is just what it is. It's kind of like a bug. Whereas a viral infection, actually the virus has a membrane around it. So that's why viral infections are so much harder to take care of or cure than a bacterial infection. Bacterial infections can be killed with medications on for the most part, whereas a viral infection, because the structure of a virus is different and it actually has a protective membrane which protects it from antibiotics or rephrase that, antivirals. Viruses are very, very hard to, or more difficult to cure than a bacterial infection. Let me see. Okay, Donnie's updating me here. No, I'm not timing you out. I almost timed you out, Donnie. Sorry. Let's see. Says we have 5 fatalities in Washington State. Actually, we have 8 now, as of today. There was 8. Let me see. 9 in the United States, 13 states. Let's see, at least another 40 states. Well, it's a pandemic, dude. It's across. Wow, 11 dead in the U.S. now. You know what? All right, guys, let's see. Bear with me here. So I just Googled death toll from coronavirus in the United States. Yeah, death toll rises to 11. So here is the okay. Thank you guys very much. I appreciate you throwing in these comments because I'm learning this. I'm learning a little more as I go through this live stream. So based on that, here's what I got. The coronavirus that emerged late last year and spread from central China was in more than 78 countries now. Pandemic. That's a pandemic. An epidemic is a large scope. A pandemic is worldwide. It's in 78 countries with outbreaks growing fast in South Korea, Italy, Iran, and the United States. At least 11 people have died of the COVID-19 disease in the U.S. All but one of them was in Washington. Well, okay, so who posted that? Was that Ben? Damn, Ben. Yeah. So 10 out of the 11 fatalities from this disease were in Washington. The other death occurred in my state, California. It's let me see. This was updated today. So this is coronavirus updates. U.S. death toll rises to 11 with California's first death. So apparently, as of today, California had its first fatality from this coronavirus. So again, 11 people. I cannot believe 10 in Washington State. And okay, hold on a second. I got ahead of myself. It says, and most of them from a single nursing home in the Seattle area. The other death occurred in California just outside Sacramento. So, kind of hospital setting, nursing home setting, and that's where the majority. I thought that was a really high number in Washington, but knowing it came from a nursing home now, that makes a lot of sense because it was a centralized area where people are holding on to handrails and they're using the same walkers and wheelchairs, and the staff is involved now, and so on and so forth. So let's see. Ben says California has the cruise ship, though that will be missed. I know. So, but anyway, the race to respond. The WHO, which is the World Health Organization, the WHO chief did issue an urgent plea for more data, urging countries facing outbreaks to test more people more quickly to bolster understanding of the disease after faulty tests were distributed last month. Oh, way to go, CDC. The Centers for Disease Control and Prevention was working with private organizations to get local health authorities across the U.S. give them the capacity to test more than 1 million additional people by the weekend. So they're ramping it up. Like I said earlier in the stream, we need CDC. Once CDC gets a grip on this, obviously fears, panics, whatever you want to call it, are going to go down. But CDC's jumping all over this. Vice President Mike Pence said 1.5 million tests would be available by the end of the weekend. So they're stepping it up. Let's see what Donnie's got here. Donnie says it's all a numbers game. There's never been nothing like this before. People need to take it serious. Oh no, don't get me wrong, Donnie. I'm not saying don't take it serious. That's what I'm saying. Stay away from the airports where people are coming in with international flights. Don't do the hospital pickups. Sanitize your vehicle. Carry hand sanitizer. Bomb the shit out of your car with Lysol. I mean, it's not a joke, and I wasn't trying to make it a joke. And like I said, after I'm done with the live stream, I'll try to do a more condensed version of this. But hey, Roy, glad you're back. But no, I'm not saying not to take it serious, Donnie. I'm just saying, if we all panic, then we all just might as well stay home, park our cars, stop doing food delivery, stop doing rideshare for the next month until CDC and WHO get a good grip on this thing, and just not do anything. I mean, call the first responders are sick. Whole fire department, they're gonna die this week. Watch the news. Well, let me see. They've got live things going on right now. Let's see what they're saying.
The difficult part for me was starting.
Hold on.
I lost about 20 pounds, which blows my mind.
Oh, of course. Let me turn this down because it's an advertisement, and I don't, want to share an advertisement. It's on someone else's thing. But oh, what's up, Creative Jay? Welcome to Rideshare Trickster Home. We're talking about the coronavirus. If you didn't see the tag, I'll be doing a video on it, much more condensed in the live stream. Okay, here we go.
Tonight, Los Angeles County, where 10 million people live, has declared a public health emergency. This comes as California is reporting its first death. And we've now learned that a worker at LAX who was screening passengers for the virus has tested positive. And in the suburbs just north of New York City, at least 2 families are infected, forcing 1,000 people there to self-quarantine. Nationwide, there are now at least 153 confirmed cases. 11 people have died, 10 in Washington state alone. Our team of correspondents is covering all of the angles of this developing story. Carter Evans leads us off in Kent, Washington. And Carter, I understand there are new safety measures that are being taken where you are?
Okay, so there you have it. 158 confirmed cases in the U.S. 158 confirmed cases in the United States. There's a lot of people in the U.S., but again, I'm not trying to downplay this. Ben? Ben says, let's see sorry, hold on. Ben says they kept taxis running in Wuhan. Yeah, you're right. They kept taxis running in Wuhan, Providence. I'm sorry, it's jumping around here. Hold on. And they were repeatedly, well, yeah, because, and I agree. Ben made a good comment there. If you guys can read it, they weren't using personal protective gear or PPDs, personal protective devices, and they just kept doing their normal job. So, it's like I said, I'm not telling anybody not to panic, but I mean, if we do then like I said, we might as well just shut down until CDC's got a good grip on this. Until then, we do have a choice. Remember, we are independent contractors, and I don't know what Lyft and Uber. I mean, I know what they've sent out because I'm on both platforms. But like I said, this live stream wasn't to discredit either one of the rideshare platforms. It was just simply to put out, in my opinion, and again, this is strictly my opinion based on the research I've done today regarding COVID-19. Then that's what I'm going to call it, because I don't want anyone giving me a bunch of crap about it. So I'm just saying, if it's and I'm concerned about it. I mean, I don't want to bring this home to my wife. I don't want to bring this home to my my kids or my family or anything. So yeah, I am taking extra measures. I am bombing my car with Lysol. I am I do have hand sanitizer and stuff like that. And I am, I don't do airport rides anyway, but I am kind of backing away from doing the hospital pickups, which are normally good rides. But I have to, our safety comes first. Bottom line as drivers is our safety comes first. And it's a pandemic. It is worldwide, 78 countries. And what is getting me is 158 cases in the US and 11 deaths, 10 in Washington State, like Ben said, and most of which came from a healthcare facility, and then the one here in California as of today. But what's happening in the other 78 countries? They're just saying it's in 78 countries. They're not. Why aren't they telling us? And Donnie mentioned a good point. Is it a numbers game? Are they keeping numbers low so they don't create a panic? Of course they are. Ozzy Osbourne made a song called Crazy Train, and I've actually there's a verse in that song that is so strong even today, that I don't even think he knew just how deep that lyric was, and it's basically, the media sells it and you live the role. Crazy Train. The media sells it and you live the role. So whatever the media says and whatever the media is putting out there, we believe it. And of course, you look at, you watch your local news or world news or whatever, and it's always about the negative crap that's going on. What about the officer that saved 2 kids from a burning car? What about the firefighter that went in and pulled 5 elderly people out of a burning home? You don't see any of that stuff. You see the bad. Why? Because the media is selling that and you're living it. And so I honestly believe you're right, Donnie. Go get your pinger. But now you got me on a little riff here. You're right. The CDC and the World Health Organization are going to keep the numbers down because they don't want to start a panic. My God, there are a couple of posts I've seen where the lines for Walmart and the lines for Costco were, halfway through the parking lot before the stores even opened, and people are buying, especially at the bulk stores. They're buying cases of Lysol and cases of antiseptic wipes and cases of hand cleaner. The people that are there at Costco, though, are usually the ones that are... Mike Trenton, dumber than a box of rocks. Boring old news. Well, Mike, you can leave the stream. I don't care. I'm just my opinion here. I got people that are interested and want to know. So... dumber than a box of rocks. I appreciate that. Well, I'm not. You know what? I'm not even here. Let me take care of this real quick because there you go. Enjoy your 5 minutes of fame of not being able to say anything. Really, Mike? Well, tell you what. We're going to give you the flush. Bye, Mike. So, anyway, yeah, we got a troll in the house and computer tough guy here, so whatever. That's where we're at. We don't need Yeah, we don't need people like Mike in the house. He's just one of those, got the small man complex and thinks, if he boasts himself and, oh, I can say this on the computer and I can smash your live stream. Yeah, who gives a crap? Go. Yeah, I'm not gonna say it. I want this video to stay up. So anyway, again, coronavirus, COVID-19, presents like the flu: cough, runny nose, nasal congestion, low grade to mid grade fever, aches and pains. Get yourself checked out. Notify your healthcare provider first. That's what they're asking. That way they can be prepared when you show up. Hey, Donnie. That's okay, Lisa. I just had to. I literally just completely blocked some D-bag that was Mr. I lost the number, so he's gone. Yeah, he was just being an idiot. So I think I found my trolley though for my video. So I'm just gonna block his dumb ass from my channel. So if you're watching this still, Mr. D-bag that I just blocked from this live stream, if you don't want to leave the channel, I'm gonna kick your ass off the channel because I'm a 51-year-old man and I've probably seen more in my life than you'll ever experience in the things that I've done. So you can go piss up a rope, and when I find your name in my subs, I'm kicking your ass off because I don't need people like you on my channel. Sorry to be so vulgar. Again, I'm marked as 18 or over. This is my live stream. This is my channel, and if you don't like it, you can kiss my ass because that's all there is to it. So with that being said, guys, I'm gonna end the live stream. I gotta get ready to head out and get on the job, make some money. Again, stay away from the airports, stay away from the hospitals, carry Lysol, carry hand sanitizer. If your passengers end up coughing and stuff in your car, turn your app off for a few minutes, hit it with Lysol, let it run through your air system for about 5 minutes or so, and just keep everything clean. You'll be okay. Hey Ben, by the way, before, what was that dude's name? If you remember it, can you put it in the comments? Because because I completely flushed his ass off the channel, I may have a hard time finding it. Do you remember what it was? Because you may. Oh, you know what? I'll just look at. You know what? Never mind. I'll look at your comments because you left his name in a previous comment. Oh yeah, Mike Trenton. Mike Trenton. So if you're watching, and Mike Trenton is one of your subscribers, Mike Trenton is a D-bag, and was here completely. Thank you, Ben, very much. Mike Trenton is garbage. Sorry, Mike. But you know what? My channel, I can say what I want, and your history. So that's all there is to it. Watch after yourselves. Keep your vehicles clean. Keep an eye on your passengers. Listen this time. Not to what they're saying, but what they're doing. Coughing, sniffling, blowing their nose, sneezing, what have you. If you have a passenger like that, get out of the car. Hit it with some Lysol. Like I said, turn your heater on to high, turn the blower on to high, recirculate your air, balm the car with Lysol for 5 to 10 minutes, let it do its thing, air the car out, start your night again. Wash your hands, everybody. Wash some of the surfaces down. I'm not going to panic about it. I understand, Go Donnie, COM. Check him out if you haven't checked out his channel, by the way. He's really funny. He's got some pretty interesting stuff. But he's a good guy. And he brought up some really good points, and he did. He made me do some more research. So thank you, Donnie, for that. And there's nothing but love here. I've got my moderators and stuff. Ben, thanks again for stopping in. Lisa, I wish you could have moderated this Mike Trenton guy. You would have loved it because it felt so good to flush his ass down the toilet. Everybody, have a good night. Go make your money. Listen to what your passengers are doing, not what they're saying, for a little while. Coughing, sneezing, clearing their throat constantly, so on and so forth. Go back to, like I said, spray the vehicle, wipe the doors down, take a few minutes to take a break, and if you're Roy, or like myself, fire one up, and Mr. MD, go right ahead. What's your question? What are the demographics of coronavirus? Okay, that's kind of that. That's a little open-ended question there. You want to be a little more specific for me? Never mind. I just got it. Took a second. Haven't worked in the medical field for a while. Oh, you're in China. Oh, right. Okay, hold on. It's the demographics for the coronavirus right now, from what I've read from the CDC and from the World Health Organization. Right now, as of today, the demographics for the disease are young children, infants, newborns, and the elderly that have high blood pressure, respiratory problems, already have underlying issues, what have you. Hang on a second. I am going to look that up. I'm going to get into that just a little bit more, because that is a really good question, and I misunderstood it at first. But underlying issues, yes, definitely. The underlying issues are, like I said, high blood pressure, compromised immune systems, COPD, CHF. Those are all obviously detrimental factors with anything. I mean, like I said, the flu can kill an elderly person or an infant with a compromised immune system. So, question: how many black people have? That's a good question. Hang on a second. I don't have a problem looking that up. Bear with me, guys. That's a really good question. 0. Really? Interesting. That's one I didn't look up. Very good. Thank you. I can't read the name because it's so small right now. CDSMD. Oh no, I'm not. No, it absolutely. It is no way a racist question. But you're right. It got me thinking. That was a very good question. But yeah, it definitely got me to look. Let me see. Let me double check that. How many God. How many African American? That's a really good one. You know what? The interesting thing is, MD, is you're right. I'm not finding anything regarding that. None. Wow. That's pretty good. But you're right. You got me thinking. What would you say there? The ones that have been reported in Africa are 2 Italians. Very good. Next question. All right. If I said in conversation, what? If I said coronavirus is not a virus, then the next question is, how is it spread then? Bend over. I cannot believe it took me that long to catch your handle. Oh my god, dude. That's pretty funny. Actually, Italian is kind of like their own version of Polynesian, which is a very large mix of people. Oh my god, Ben. You've been in the stream for how long now? And I've been calling you Ben, and oh my god, that was That was really good. But but uh Thedius, is that how you say it? Thedius MD brought up a really good point, and he got, like I said, it wasn't a racial question. It was a very good question, and I didn't think about it. How many African Americans have contracted the coronavirus? None, none that I'm aware of, none that I can find. And like he said, the only two cases in Africa were from Italians, and I come from an Italian background, so. But really good question. Let's see. Is the spread through oxygen bad? Green radicals. MD, it's spread just like from what I've read and what I stated earlier in the video or in the live stream. It's spread through droplets, saliva, nasal drainage, just like a cold or the flu. And of course, when the droplets land on the surface, now that the surface is infected, what I did say earlier in the stream also was that the virus can live in a dormant state on a surface in the right conditions for up to 9 days, is what I saw in the CDC. If it's on steel or copper, then they're saying at most 2 hours, but they're still doing tests on it. But it can be spread through airborne, through droplets from coughing. CDC is recommending that, if you're chatting with somebody, keep a 3-foot distance. Although if you sneeze, a sneeze can travel 25 feet. So a cough can travel in upwards of 15 feet. And if somebody coughs and don't cover their mouth, well, guess what? You may get, so hang on a second. Let me see what you got there. 5G is really... Sorry. I do believe 5G in the medical field is really is definitely the latest thing. I've seen some of the videos done on that, and it's pretty damn amazing. And I also know the firefighters and USAR and USAR and other search and rescues are using it too. So, but thank you for if you are from China and you are here to help us out. Tip of the hat to you for coming all that way to help us. That's a very, very, very humble thing to do. So thank you, Mr. MD, for joining the stream. I do appreciate it. I'm a little settled down now. Donnie got me wound up a little bit, but let's see. Are we? That's I don't know. 5G is man, that's up there. That's almost microwave. I mean, if it from what I know, let's see. Nanowaves are disrupting the oxygen molecules. Okay. I'm not gonna disagree with that, but I think 5G is I think, like I said, it's just, I don't think there's enough known about it yet to really gauge one way or another what it's doing. I do know that some of the breakthroughs that 5G have made are pretty impressive, especially in the medical field. I'm looking at your name, MD, and from where you came from. So, I think you would agree that 5G in the medical field is definitely been something that has been beneficial. That's why they call it a medical practice, not a medical science. It's a medical practice because we're continually learning new things, i.e. COVID, ID-19. We learn something else, and hopefully we'll learn how to take care of this and wipe it out again, Medicine is always growing. It's always advancing. And, 100 years ago, common cold and the flu would kill 100,000 people in a matter of a couple weeks. And now look where we're at. So, have you ever heard of animals catching the flu? I heard of the bird flu, and that was a flu that was contracted by birds and was subject to human transmission. So,
COVID's been found in dogs and cattle.
What's that?
COVID's been found in dogs and cattle.
Yeah, no, my son just brought up a good point. COVID has been found in dogs and cattle. So, and that is a human disease. So, yes, there are diseases that are, and they're rare, but there are diseases that can be transmitted from humans to animals or from animals to human, such as COVID-19. It was found, the origin of it was found at an animal rescue. So, what does that say? The animals there are infected, the humans got infected, I don't know if it's affecting. So 5G, it's 5G affecting oxygen fast. I don't know. I have no idea what 5G is doing to the oxygen. I mean, what does the microwave do when you put your food in the microwave? It accelerates the molecules. I don't think it's hurting the oxygen. I just think it's accelerating the molecules to the point where the friction becomes so much that it creates heat, and boom, you've got your food. So, okay, I guess I'm not quite following you on the way you're asking the questions, but it's in animals because they breathe it. Yeah, well, it's in us because we breathe it too. So, I mean, let me ask you. All right, I'm gonna ask you a question, MD. What's the percentage of oxygen on Earth right now? What is the percent of oxygen inside our atmosphere? And it's gone down, by the way. From last time I checked, from 30 years ago, it's gone down. What is it? Thaddeus, MD? What is the concentration of oxygen in our atmosphere? No, I'm not getting... I'm sorry. I'm not getting upset. I just wanted to know. I mean, I got a question from you. Where was it? No, I don't know. Anyway, you wanted me to answer it fast, so I was just throwing that out there. I just wanted to see if you could answer it fast. It's 21%. Anyway, I agree, Ben Dover. But anyway, I mean, again, that's the problem with what's going on right now is everybody's got their own ideas, everybody's got their own opinions because everybody is an individual. Doctors, nurses, first responders, rideshare drivers, contractors, people that work in grocery stores. I mean, everybody is an individual. Everybody's going to have their own opinion on what's going on. I just simply wanted to start a live stream to try to help people understand it a little more. Try to, quell the panic and stuff. I mean, oh my God, I read an article on New York cabbies. I wish I could find it. I'm not going to go back and look at it. It was off the chain what these guys were talking about, and just how the way the media had presented this to them. The taxi drivers were just, they weren't even going into certain areas, and as a taxi driver, you need to pay for that cab. As an independent contractor, I guess, yeah, being a taxi driver, you have that option. But, if you get a ride request from that area, I guess you don't have to take it, kind of like not picking somebody up from a hospital or an airport. But, are you going to lose money? Probably a little bit. But, again, I'm going to come home at the end of the night, and I don't want to bring anything home to my family that could be detrimental. Or I don't even want to bring the flu home. You know what I mean? I don't want to bring a cold home. So, again, I didn't start this live stream to get it blown out of proportion. I simply started the live stream to explain to people from my perspective and from my medical training and my medical history what this was about, what the signs and symptoms were, what to look for, how to get yourself looked at from your physician, what the CDC was saying, what the World Health Organization was saying, how to keep your cars clean, and how to simply do the best you can to protect yourself against this. So I'm going to run it by one more time, and then what's up, Donnie? All right, go get that pinger panger. COM. Check out Go Donnie COM too. He's got some really good stuff. So I'm going to conclude this. I've been on for an hour, and it's time for me to go out and hit the road. The one question that has caused him to verbally rod. No, I think you're mistaken on that one. I'm ending the live stream because I need to get out and hit the road. Run. Okay. So, COVID-19. It presents itself like the flu. If you have flu-like symptoms, low-grade fever, runny nose, cough, congestion, aches and pains, difficulty breathing, shortness of breath, call your medical provider, call your urgent care, call your emergency room, let them know what symptoms you're presenting with so they can be prepared to accept you. That's what the CDC is asking everybody. If you are really trying to stay as far away from this as possible, don't go to the airports, and don't deal with the international flights. Just stay away from the airports. That's easy. I don't ever go to the airport. It's not worth my time to sit there for 2 hours to possibly get a $10 ride when I can make $50 or $100 in 2 hours. So airports aren't my thing anyway. Don't do medical pickups at the hospitals if you're really that concerned about it. Again, keep hand sanitizer in your car. Make sure you're doing your hand thing. Don't make sure your hands are clean. Balm your car with Lysol. Use antiseptic wipes. I have leather interior, so it makes it easy for me. If you have cloth interior, obviously it's a very porous material, so you're going to want to get something in there. Lysol works great. Turn it up all the way. Turn on the heat. Turn it on recycle. Balm your car. Get it nice and foggy. Let it run its course for about 5 minutes. Air the car out. You may get a film on the window, so you might want to carry some glass cleaner and some towels too. And just, again, instead of listening for names and stuff like that, which we already know that we need to do, listen to what your passengers are doing. Listen to coughs, clearing their throat, whatever. A lot of blowing their nose, what have you. Get a passenger like that. We already know that we can't say anything. We already know that we can get deactivated temporarily or permanently if we just say, like, you know what, I want you out of the car. Complete the ride and do what I said 35 seconds ago. Balm your car, wipe everything down, take a break, and go back to it. So, yes, I do absolutely agree with that, Theodis. Health is wealth. And we're not talking money. The healthier you are, the better life you have. The more energy you have, the more things you can do, the time you can spend with your family, your friends, the time you can spend doing the things that you want to do. Health is absolutely wealth. And that is a very bold and very strong statement that I agree with 100%. So, now run. Well, I really do. I gotta get out and make a few of them little, I don't even know who the hell's on the dollar bill anymore. So with that being said, guys, thank you so much for joining the live stream. I hope there was some information here, because we went way off the rails about 30 minutes into this, but Dr. Theodis, I hope I'm not butchering that name. Theodos, Dr. MD, Mr. MD, who is in the house, who came from China and is here on a mission to help with this. Thank you very much for joining the live stream, and thank you for for your help with this, and for assisting your fellow people and countries and what have you, from China. Yes. So again, but thank you for coming. Are you in China or are you in the United States right now? You seem to be a pretty quick typer. I think you said you were here in the States to help out, correct? Thaddeus? He is in China. Okay. Okay. But again, thank you so much for joining the stream. And again, everybody, I didn't mean to go off the rails like I did, but Dr. Thaddeus here brought up some really good points and got me thinking. And I you know, I'm not going to say I'm perfect, and I did miss a couple things. Thank you, thanks Thaddeus. I appreciate that, and you know, appreciate what you do too. Shut up, Ben. So again, like I said, guys, thank you for joining the live stream. I am going to do a condensed version of this, hopefully about 10 minutes, and but I am going to get ready and head out. So again, thanks for being a part of the chat. Thank you, Dr. Thaddeus, for the insight, and I did get a lot of really good insight from you. I got some pretty good insight from Donnie, Go Donnie COM too. So with that being said, you guys, as always, be safe, be professional, keep it real, and drive on. Thanks for joining, and again, be safe out there.